Hello, everyone. Welcome to the webinar today on returning to office and viewing it through the business architecture lens. I'm sure we'll have a few more people hop on here. But I just wanted to let you know that we are recording today's session. So if you're nervous about that, now's your chance to hop off. Before we launch into Bao's presentation, I'm going to take some time. Oh, sorry. And I'm Beth Schaefer. I'm the director of the Institute for Professional Development at Metropolitan State University. We are the continuing ed customized training arm of the university. And we sent out a survey on return to office, and maybe some of you participated in it. So I'm going to share the results of that survey quick, and then we will move into Bao's presentation, which he assures me is jam-packed, full of information today. So let me see if I can get everything to work here. Maybe, sorry, you always test things and then, okay. Did it change, Bao? Are you seeing a new
It has.
All right. Yep. So as you can see, this is our very unscientific business return to office survey. The survey crowd was 44% government industry sector, which is not surprising because our department does quite a bit of training for cities, counties, and state agencies. So our client base is heavy public sector. So it's not surprising that a lot of the folks who responded are public sector. And then a big chunk in education. And then, as you can see, technology and finance round out the people who responded. Here's how many people worked at your organization. Not a lot of small businesses responded, larger. I don't want anyone being judgy about the I'm not sure person. That happens. I feel like I should say it depends. I work for Metro State, which has one number, but I'm also part of Min State, which has a larger number. But when it comes down to it, technically I'm a state employee, so that's a whole different number. So I get how you're not sure necessarily sometimes which organization you're a part of. Currently, my company, you can see that while there's been a lot of talk around returning to office, very small percentage of organizations that responded to the survey have actually returned to office. When Bao and I were talking about this presentation, I don't know, 3, 4, 5, 6 months ago, and we couldn't get them scheduled till November, I'm like, oh, I hope the topic's still relevant come November. And here we are, and it's still totally relevant. People have either delayed the transition or are maybe don't even have a defined date anymore or are still in the process of the transition. So it's still a topic on people's minds. It was interesting, as part of the survey, you could respond that your organization either had remote work options prior to the pandemic or switched to them during the pandemic. Of those who switched during the pandemic, only 2 plan on keeping remote work options once the pandemic simmers down. So lots of folks at set point heading back to the office. And of those that had it before the pandemic and plan on continuing it after the pandemic, we had a list of reasons of why they would offer remote work options. And they could check off as many as they wanted. Every single organization who's keeping remote work options checked off this one, that it's more attractive to prospective employees. So they may have checked off other things, but every single organization who's keeping remote work options thought this was one of the reasons why. We had 2 very distinct groups of challenges. So I called one group the most frequent challenges and then less frequent. So a lot of people, a large percentage of organizations responding said that one of their challenges is making sure that they are actually keeping their employees safe during the transition back. And we know that we are living science right now, right? So everybody's got a lot of sources of science, and it was actually good to hear that employee wellness is factoring into decision making. Another challenge was that I think the supervisors, or those of us who are middle management, said that a lot of our people feel that they are returning to the office for the sake of returning to the office, and that is hurting morale. People are like, I've been fine working from home. Why are you making me go back? And that some are even losing good people because they can go work for other organizations that are still offering flexibility. And then putting Humpty Dumpty back together again. So combining the people who never left the office, who had to keep going in the last 2 years, with those who are returning, apparently is a source of conflict. They bring different lenses and different perspectives. I didn't collect a lot, but I'm guessing that you've got a group of people who are coming back begrudgingly, like, and you got a group of people like, hey, I never even got to leave. So kind of a wedge between folks. Then less frequently mentioned, and kind of all except one in the same kind of pot, was you got vaccine mandates that you're implementing, or depending on how the courts rule that day, not implementing. What kind of policies, and of course the policies are ever changing as the science changes. Then I'm sure, COVID had a resurgence, so pushing back. A lot of people mention trying to maintain the 6 feet. You haven't been given any more square footage and you have the same amount of employees. So where does the 6 feet apart come from? And then trying to do business as usual with serving customers and clients when in all actuality, we really haven't returned to business as usual. So that's the end of the unscientific survey. Thank you for participating and sharing what's going on, I guess, in your return to office work lives. I will be turning the presentation over to Bao. He is an instructor in our business architecture certificate program. We are launching a virtual certificate in January. We kind of started teaching it virtually, but now we've actually designed it to be virtual. So it should be a really good experience. We've piloted it with a couple of companies. This is an opportunity for you to sign up as an individual. We are offering an introductory price because it is the first time that we are offering it to the public as an all virtual class. And early bird pricing, an additional 20% off until December 19th. And so with that, I will quit sharing so that Bao can share his presentation, and you can learn from his expertise. Oh, it was out in the materials, but Bao is in charge of the return to offered effort for Wells Fargo, which is where he's a great business architect. He was a great business analyst, and now he's using that to do this effort. So Bao, all you.
Yep. Yeah. Thank you, Beth, for the introduction. So welcome, everyone. And so today, as Beth mentioned, we're going to be focused on looking at return to office, and we're going to take a business architecture view of this work. And so a lot of this, let me page up here. So a little bit about my background. So the most prominent point that's pertinent to our group is that I've been doing business architecture for over 10 years, well before there were certifications in place. And so, there's a lot of work that goes into it. It's a evolving topic. The discipline is still very much nascent and really developing a lot of standards and really good participation in the industry. So you're seeing more and more job postings. I actually got 2 job recs for contracts needing a business architect in the last day. So that just kind of gives you an idea, whereas even a year or 2 years before, you didn't see a lot of contracts that were specifically titled business architect, but that's coming along. And so it's really a good vocation to explore if you're interested. So today, there's a couple of things that we're going to do, and I'm going to have to go ahead and apologize. As Beth mentioned, I have a lot of data points as I researched and developed this material for you all today. I realized that, it could easily been 2 or 3 or full day session. And so today, what we're going to focus on is really revisiting COVID at a glance, looking at business architecture and some of the steps we use to approach this complex issue. And then we definitely will hit on experience design considerations as part of that. Digital economy, at this point, I'm going to treat it like a bonus section. So if we somehow manage to get through these slides, we'll take a look at that. And then we'll wrap up with some key points for you to walk away with as the primary insights for this session. You know, our group today is very small. It's only a handful of us. So let's treat it like a fireside chat. If you have questions and if you want to hit pause anytime, let's just do that. And let's just make sure that the time spent is good for you. And so jump in with questions, with comments, share any experiences. And so as you know, Expert Insights, we do a lot of research and we bring together a lot of the industry knowledge to you. And so I just want to, you know, start with that this is really about leveraging business architecture to explore return to office. And so really it's a discussion and exploration. It's really time for us to kind of share with you, you know, what we were seeing in the industry. This is assuming that you have some working knowledge of business architecture. So it's not going to be an in-depth dive into all the intricacies of business capability mapping and all that. We'll touch on it, but we won't dive into a lot of depth there. We are going to be looking at some capabilities and understanding how to align that. And we're going to explore some design principles and some design considerations around, you know, questions you have to ask, you know, around strategic planning, what the business value is, how it impacts employees. And then on the right-hand side, you can see here that this is not really a case study or anything scientific or political. We're not providing any validation of editorial on RTO strategies and justifications around that. We understand that these are personal decisions. These are decisions that companies are making and that you'll have to work with your internal management team to do what's right for you. With that, so let's dive into it. And so with RTO, it's been, the moniker right now is the Great Wait. So as you go back to work, these are questions that are popping up all over the country where people are trying to figure out what makes sense for them. And so we're going to explore some of these questions today, and then we'll take a dive in to make sure that we understand what the situation is with COVID first. So at a glance, you all know that we're living in a pandemic environment and that there are still a lot of practices in place to safeguard our well-being and health and making sure that we're controlling the pandemic. And so you can see here the latest statistics worldwide, how things are impacting. And so the US definitely is one of the heaviest hit countries in the world. In sheer number of case statistics, you can see our caseload is still pretty heavy at the top of the list here. And this is as of 2 days ago on Saturday when I pulled this, and Sunday. And on the right-hand side, you can see from a vaccine perspective, there's still a lot of work to do. And so our caseload and our vaccine are not commensurate in terms of what we're expecting. So with the amount of cases, we expect to have a heavier, you know, or be further along on the vaccine. So thank you, Beth, for the reminder to use the chat. So if you have a question, I'll be monitoring that. If not, Beth will remind me. So definitely jump in with any questions. So something that's been emerging with the pandemic, part of the reason why we're still operating under very strict guidelines is that the COVID has created variations. And so there are many different types of variants out there. And so in my research, I found out that the CDC classifies them very, very differently. So the variants of interest, of VOI, the Delta variant is the key one that we're paying attention to, which is called a variant of concern. And so these variants can range from variants of interest to variants of concern based on the severity. And the Delta one is something that has made its way to the US. I believe it was originated in Europe, but has made its way over to the US and definitely is the highest concern that we have in the US at this point. And you can see here that these are the numbers that are assigned by science. And so Delta is this one right here, the B16172. And that's the one that is going to be of key interest going forward in the US until we can get our arms around it. So where we are with vaccines today is that the double dose of Pfizer and Moderna are most effective per the studies that I have leveraged. And so you can see here the sources. And so any research that I've leveraged, I try to include the source at the bottom, whereas J&J, which is the vaccine that I chose, is not as effective. But overall, it is still better to be vaccinated than not. You're risking a more than 6 times impact to you if you are not getting vaccinated. And there's a 11 times a greater risk of actually worst case scenario where death could be an outcome if that is something that people are not leveraging. So no plug on vaccines, but those are the statistics that they have today. All right. And as a result of vaccines making progress, you're seeing that the government is stepping in to try to promote and push the economy forward. And so there's a lot of debate about whether this is in the best interest of the country, depending on your personal beliefs and views. But the government is stepping in to mandate vaccination. OSHA is setting workforce guidelines to make sure that companies are providing a safe environment for employees. And so you can see here the vaccination card. And now there's a lot of conversation around getting booster shots because of the evidence that's emerging that vaccines kind of wane over time when it comes to COVID. And so you want to consider that if you're interested. As the government steps in and starts looking at the return to office, corporations are trying to line up and trying to figure out their strategies. And you can see here that different companies are taking different measures. I work for Wells Fargo, and so you can see I'm very interested in what different financial companies are doing as part of supporting my organization's RTO strategies. And so, Bank of America, really wants people to be back in the office. JP Morgan is working with their legal team to understand the impacts, as well as Goldman. There's a lot of legal risk around it, right? You can open yourself up to a lot of lawsuits and whatnot, depending on how you position your requirements and what you are asking of your employees. And so you can see here through the course of time that other large firms are starting to take action as well. Walmart is invoking their strategy, Citi's taking a position on this as well. And then other companies you'll see more and more in the media as companies, get back to normal as business as usual. We know that the new normal here is different. And so these RTO strategies are probably going to reshape how we are going to work in the future. And so the coming months are going to be very, very important as employees provide their voices as customers to this policy of what is going to be acceptable and what is not acceptable in the workplace. All right, let me pause here because this is the last slide in this section. Any questions on COVID or the state of COVID and its impact to the workplace to date? So I'll give it a second or two to see if there's any questions or comments on chat. All right, I'm not seeing anything come across. So how do we apply business architecture to RTO, given that this is a pandemic environment where health and well-being, and this is actually a matter of life and death for some of us. And so it's really, really critical that corporations get this right. So here's a simple slide just as a refresher for business architecture. So like any problem, first thing we need to do is understand the problem or the opportunity. Second thing we need to do as business architects is we need to identify the business capabilities that are impacted. The third thing we have to do is to rationalize those business capabilities. And this is where we're going to be looking at metrics and trying to explore impacts and really trying to justify and understand the mappings. And so there are going to be systems involved. There's going to be process. There's going to be procedures. And there's going to be locations that are more impacted than others, different levels of essential personnel, and a lot of tiering of impacts to understand prioritization and what the rollout schedule would be for returning to the office. Step 4 would be then looking at understanding those insights and designing solution options. And that's going to be where we have more questions to explore and trying to understand what is the answer that we need to provide in order to work with staff to return to the office. And then validations of the solution. So here, this is very, very sensitive because validating solution options means that we are exposing people to COVID. So we need to make sure that we roll on in a safe, and the reentry schedule is something that is carefully thought out and carefully executed. And my apologies, my office is located next to some construction that is being worked outside. So understanding the problem or opportunity. And so here, for those who are well acquainted with business architecture, we have to really make sure that we're aligning to the business value of what we do. And so we need to understand the corporate priorities. We need to understand the corporate strategy, understand the corporate costs. So really aligning to that is going to help us do a couple of things. We need to understand the customers as part of the strategies and priorities. And here we're talking about employees. So people like yourself and myself, we need to be safe. We need to be in an environment where our work is not disrupted by fear of our health not being taken care of. And so understanding who's directly impacted, and with something like the pandemic, we really need to take a look at who is indirectly impacted. When we expose ourselves to the pandemic, we are putting risk to others that we care about, our families and our personal lives. And so that's something that's really important as a business architect in the space to really consider. Social bubbles, expanding them, commingling social bubbles. When we go back to the office, we are basically expanding those social bubbles that we have maintained over the course of summer. There's different things we have to consider about the experience. I'm hearing that people who are getting back into public spaces are actually not dealing with the common code as well. My wife and I actually just got sick over the weekend, just common code, and it seemed to take us a little bit longer to get over it. And so those experiences are something we have to consider, that social bubbles and our ability to maintain our health is really going to be something that we have to keep an eye on. Understanding requirements. And so knowing what the regulations are, knowing what our policies and procedures are and what they need to be in order to safeguard a reentry into the workplace is really important. And then understanding the problem, there's going to have to be, especially that this is very going to be customer centric, there's going to be a lot of discovery sessions that we're going to need. The companies have to explore focus groups and are really going to have to really do a lot of user interviews to really get the user experience and employee experience correct. So after we understand the problem, we need to use a capability map. So hopefully you are all acquainted with a business capability, what that is. And so for today, we're just going to touch briefly on two areas as examples on capabilities. So there could be checkboxes as you identify business capability, you're identifying areas of impact. And there's probably not going to be a single capability that's not impacted by policies and procedures and some level of review, if not changes, to make sure that they provide employees with clear direction on how to manage operations through working in a pandemic environment. So directly impacted is going to be compliance management. We're going to need to make sure that audit, policy procedures, and regulatory requirements and surveillance of progress is something that is well vetted. You're going to see that we're going to have to talk about systems, processes that are impacted in monitoring RTO, return to office. And of course, last but not, the second one that I chose for today is human capital management. We really need to think through all the different capabilities within HR that need to be explored, and most of them will have to be retrofitted and upgraded to really encompass the pandemic. So as part of identifying the capabilities, you can see here the standard business architecture work is going to be around mapping. And so if you take a look at the compliance capabilities, audit, policy, procedure, regulatory, and surveillance, We map into requirements to understand which requirement needs to be satisfied to design the solution. For process, here is some sample process that I made up for the purposes of our webinar. You have to do contact tracing. If an employee gets ill at work, you're going to have to quarantine them. If a visitor comes in and is experiencing symptoms, or do you allow them to enter if you know at the time, or if you're not, during the day at Wells Fargo or some financial institution, if something happens, do you have a place where you can have the visitor can be quarantined, or what do you do in those cases where you're identifying that there's an impact there, and how do you get the contact tracing to establish a full traceability of personnel that are impacted, that are employees of the company. How do you validate that you're complying with OSHA at various sites and locations? The larger institution that you have, the bigger your footprint of locations you have to cover. How do you validate vaccination? Is that something that based on over time that the science dictates that there needs to be a booster shot? Do you have to revalidate? So there are different processes that you have to explore as part of that. They can relate to regulatory impacts. They can map back to policies and procedures. They can be something that you have to have as part of surveillance and monitor on an ongoing basis. As you start to map these capabilities, you're going to have to look at the different systems and applications that are impacted. And so you have to map them to the different processes that require the support of a automation system. You have to look at the different types of information and how do you track these informations over time. Do you have a dashboard for your management team? Do you have a dashboard for your executive team? Statistics for your employee staff to make sure that they're, seeing the transparency, because transparency is going to be very important, that your staff feels like they understand what's going on. You want to make sure that as a corporation, you provide the information before the employee finds information from others, because that gossip or that unofficial news is going to potentially create panic. And so you want to control that and provide information first to your employees. And then, of course, mapping the different roles within, who are your essential personnel that need to provide direct service to your customers, who are your indirect and non-essential personnel that need to return to the office, what makes sense for maintaining your innovation and conversations and productivity. And so there's a lot of assessments that HR is going to have to make in terms of how do you tier those, that workforce. And in some cases, you're going to have to look at the high risk and low risk populations of your staff. Is your company has a staff that is higher risk in terms of age population or some type of health condition that you have to explore? And so understanding your population of employees and their health status and their risk profile is really critical to developing a return to office strategy. So the third step with business architecture, and I'm not seeing any questions, but if I'm moving too fast, definitely do pause me for questions. So rationalizing the business capabilities. So what you want to do is gather as much historical data as you can and gather industry data, being that this is a pandemic situation where most of us don't have access to that data. We're going to rely on a lot of industry data, but where possible, even trending over the last 10 months and exploring how your essential employees have been performing and how the pandemic has impacted them should be good insight to how you can slowly and control the rollout of your schedule and reentry of different employees at different locations. So if you haven't, definitely tracking that data and making it part of your history is going to be important in terms of the next box. So benchmarking. You want to establish a baseline in terms of what your company wants to do. And you want to really look at the policy and procedures and make sure that those policy and procedures are supporting your benchmarking so that you can set standards and expectations with your staff. Without policies and procedures, it's going to come across willy-nilly. It's not going to come across official. And you really want to make sure that the staff feels like you're focused with a lot of good intention, a lot of good metrics and data, and that there is something official versus unofficial. And last but not least, as you rationalize, a lot of the work that architects do is going to be a lot of analysis. You're going to take that baseline, you're going to take that industry analysis, and you're going to do comparative analysis, and you do competitive analysis with your industry peers. And this is really critical because what the problem set that we're dealing with, it is life and death to a lot of us. And so I lost my father over the summer because of COVID. And so it's one of those things that it's very, very critical that here's something that business architecture can play a space in providing safety at the workplace. You want to leverage those industry insights, CDC and the World Health Organization, and you want to explore the gaps that your company has. And here's a sample dashboard where you're looking at new cases, quarantine, vaccinations, critical cases that are happening at your company overall, recovery rate and things like that. And so the nice thing about COVID is 90% of the population does recover. And so the risk is less for the average person. But again, you want to explore and understand the health profile of your employees before you request their reentry into the workforce or the workplace. So designing solution options, we want to make sure that we're asking all the right questions and really understanding where things are at with people. And so when you look at HR, you have to really start looking at employee benefits. You're going to see in some of the data that I'll share a little bit later in the experience section of the webinar, that a lot of employees are now expecting and that remote work has to be a benefit. There's a lot of self-reflection that's going on where employees are really trying to figure out, is it worth the risk? Is my life, is my health, in the least my health, is it worth the risk? And so companies are exploring bonuses. Does your company, is it in a competitive environment that requires people on site? If it does, is there anything you can do to entice or incent your employees to work on site? And if you don't offer these different types of benefits, what is the morale and empowerment impact? What's the engagement like? I'm sure most companies, your company, like most companies in the research that I found, are experiencing a lot of retention issues. As a matter of fact, I'm pretty sure you all are aware of the Great Resignation, where depending on the industry and company, people are having a hard time filling in positions. And so the remote work is a true requirement for a lot of employees that is being leveraged as part of the pandemic. And really, you really can't blame them. Health and well-being is really, really critical, more now than ever at the workplace. So other questions you can see here that's listed out, I won't read them all, but the dynamic has caused people to raise questions such as shortening the work week from 5 days to 4 days. And so there's a lot of new studies being done on productivity. And so HR departments really need to focus on gathering that data and looking at how the workplace experience is impacting the ability to acquire talent and keep talent in-house. So it's not just a matter of compensation. It's not just a matter of a benefits package with that, but it's also about how do you develop the staff, how do you ensure productivity is occurring. And so data is really, really critical. So for those of you who've been working in the big data space, this is new metrics and new baselines that companies are going to have to track. So when we look at the other capability today, the compliance management, there are 4 simple capabilities I have as examples for discussion today. You're really going to have to really understand what can companies can really control within their scope. What can they really request of an employee that is, not going to be disrespectful to someone's sense of well-being, and health. And so, and how do you monitor the frequency of these things? How do you ensure compliance? Are you checking people's health every day? Is there going to be a temperature check at the door every entry? Is there going to be a monitor on every floor? there are different companies that are exploring different things, very, very innovative. I came across one company, for example, that is, a social distancing key fob. And so you wear like a key fob on your belt. And when you're within 6 feet of another key fob, then it starts to beep and vibrate so that it reminds employees to manage 6 feet distance. And so those are different innovations that companies are doing to make sure that they're managing and shaping behaviors. It's an extra expense, but when you look at the changing work environment with the pandemic, um, there's no limit to what companies should be doing in terms of ensuring that people's health is number one priority. How do you manage traceability? How do you know, how do you do contact tracing because you can't control, and how much do you want to invest in tracking after hour activities with, traceability of contacts and what team members are doing? The social bubbles are going to be expanded with return to office, and people are going to have lunches together, people are going to take walks together, and what do you do there? And so there's no way to know. Someone throws a birthday party or a social gathering, and you're bringing this experience into your workplace, and those are things that you have to consider. In how much does your company really invest, because you're not going to be able to do everything on your checklist or your um, list of things to do. And so you're really going to have to zone in on what matters. And this is where it starts with the capability mapping and understanding which employees are essential to return to the office and which ones you want to allow for ongoing remote, to control this as data continues to emerge and trends continue to provide insights. You're going to really, really want to control your work environment until you have all the answers. So here's an example of something that I found where one of the consulting companies is exploring. And so you might be reassessing, but the idea is that you have to really retrofit and in some cases reimagine. Employees do not want to come back to the environment that they used to work in. Not only do they want to see social distancing and different measures in place to sanitize their work environment, and making sure that they have the appropriate PPE, but they want to see others adhere to that policy as well. And so there are different things that you're going to have to do, and I'm not going to read through this diagram here, but you can see here, do you look at layout differences and ensure there are private spaces for focused work? How do you collaborate on meetings in conference room settings? And if you're doing conference rooms where you're sitting apart, does it make sense that you just provide Zoom in place? Or what kind of collaboration would require people to be in a closed room at this point? Because as we all know, you want to be an open environment. And so if you're in a closed room, are you exploring air filtration systems to circulate more air, or providing ultraviolet lighting to help with the viruses? There are available lighting available to now to that they can kill virus. And so that's been proven. And so a lot of companies in New York, for example, I ran across a study where one of the real estate companies is actually taking on that work for um, their rentees, to provide better air filtration, better air circulation, and ultraviolet lighting to help with controlling viruses and different microbial things. So definitely something that you have to look at, because you can retrofit, but these different spaces that you have today, you probably don't want to have um, one-on-one spaces without some type of barrier, whether it's a plexiglass shield or anything like that. And so you do have to reimagine it, and you do have to understand how people interact. You probably don't want to commingle visitor areas with employee areas. You probably want to separate that out. I know that at Wells Fargo, for example, we have a lounging area. So you're probably going to have to figure out how to reimagine that space, because you don't want people lounging around, sitting there, and then not cleaning it, and then coming back to their desk, and then someone else that might come into the lounging area might be exposed to something if that wasn't sanitized. And so lots of considerations as you go through reassessing, retrofitting, and reimagining that space. So here's a snapshot of what different companies are doing. And so you can see that there's different extremes, and we do have companies embracing that. And so we have Deloitte, for example, looking at remote first, where they're allowing employees to work at home. And it's a choice to go back to the office, and there's no request for employees to be in the office part-time. They're leaving it up to their staff. And then there's companies like Goldman Sachs and Netflix, where they want all their employees in the office. And most companies are exploring something in the middle, hybrid. Can we balance a portion of the staff to be in the office 3 days a week, and then a different rotation schedule with other staff, so that we keep the population on the floor to 50% or whatever capacity is deemed acceptable by your company? And so this is something that most people are willing to embrace as a hybrid model. There's a lot of impact. There's a lot of budgets that people have adjusted to in terms of home care and this and that. And so the disruption entering into the pandemic is going to be the same as people have to go back to the office. There are going to be employees that will be more impacted than others by re-entering the on-site workplace. And so we really want to make sure that we're accommodating that experience and consider the disruption to employees as we request their presence on site. So the last step here is we're validating solution options, right? So we've designed these solutions by looking at the impacts, exploring different questions, understanding the different systems that are impacted, the different processes, updating procedures. And as you explore your options, it's really going to get to your rollout schedule of how you want to do this reentry to on-site workplace. And so here's an example one that people have been exploring. And so a lot of companies, Wells Fargo included, have pushed out their return from the summer and fall into the winter. And so I myself have been requested to return to the office as of this month. And so most companies will start with their essential employees who have to service their customers. And you want to make sure that the infrastructure and the PPE, of course, with essential employees, they don't benefit with all the insights and learnings that non-essential employees like myself are going to benefit. So a lot of those essential employees were provided bonuses, and companies have been monitoring and measuring the different impacts to folks working on site through the pandemic. A lot of the leadership teams across the country, executives, are constantly surveying employees. And so there's always an opportunity for you to provide your voice to what your company is doing. And if not, that may be a suggestion for your executive team to explore, is to make sure that they're monitoring the different things that are happening. And with spring rolling around, you can start looking at rolling on the next population and continue to retrofit your building and your site to make sure that it's at a time and place where people are ready to be on site. One thing that different companies are exploring is that with herd immunity, who knows if it's a real thing or not, but do you have a toll gate in which you want to roll in your population? Do you want to wait till 75% of the US is, or your particular area is vaccinated? Does that help alleviate anything? That's a key question I wanted to include, because there are different lines of thinking and approaches around that. And you're going to roll on the next population, a lower risk population. So understanding the health and risk profile of your employees is really critical to that. And then, of course, with summer, you're going to roll on the next population. And then this is kind of an iterative process. And so you can kind of think agile and leverage the concept of rolling on different groups at a time, making sure that your company has executive touch points, employee touch points. And then, you really have to figure out, do you want to continue adhering to your plan, or you want to adjust your plan? So infusing and incorporating your data along the way is really, really important to the strategy. So let me pause here to see if there's any questions or comments. So we're going to embrace our experience design considerations next. Any questions or comments? I'll give it a second or two. All right. So I'll continue to plug along. Again, I do have a lot of data. Just going to do a quick time check. So we have about 14 minutes left. And so with this pandemic, there has been a lot of surveys done with executive teams. So the next couple of slides are going to focus on a PwC study. And so their surveys and constant employee assessment is being done. 77% of execs are leveraging the surveys to see how the corporate culture is evolving through this pandemic environment. And so it's really interesting, though, that only 54% say that their entire board is aligned with the management, the executive team strategy on things. And so that's something that we need to, yep, PwC is PricewaterhouseCoopers. It's one of the premier consulting firms that does a lot of studies and works with a lot of big corporations to gather this data. And if you're interested, the link is down below on the slide and you'll have this available to you. And 49% of the executive team is concerned about how do you manage career development? How do you ensure productivity? And how are you working through this hybrid setting? And so there is a lot more attention on the corporate culture because of the pandemic now. So continuing with the executive perspective, a lot of the board is using data. They're using data more than now than ever because their lack of being able to be on site and see faces is really driving them to use data. So, which I think is a good thing, right? And you can see here some of the statistics. They're trying to understand the amount of attrition and turnover. They're trying to understand the customer complaints. And for us, the employee surveys is providing the voice of the customer in this context of the pandemic, as the customer is the employee, and looking at satisfaction and understanding the impact to their business, understanding the training results that are either driving results or driving outcomes with how they benefit us in terms of working through the pandemic. Other hurdles that the board is looking at. So talent management is a big, big issue. So the Great Resignation isn't just a moniker, it's a real problem. I can share with you all that in my area, I have 4 open recs due to employees leaving and looking at other job opportunities within my department alone. So, well, actually within my team in my department, there's actually more open recs overall. But so you can see here a lot of things that the management team is trying to understand: how to upskill, how to retrain, how to make jobs more satisfactory in terms of a career path for employees, and understanding the succession planning. Do you have a backup to your managers? Do you have a backup to certain employees performing certain tasks? And so a true story, I'm not making this up, but we had a staff that was leaving, and I was accountable for ensuring transition and training up another person. So both are leaving the company. So my backup to the backup has left for greener pastures or a different job opportunity, I should say. And so this is something that executive teams are paying attention to because it's rampant. So let's shift to the employee experience perspective. So as you think through experience design and trying to understand, the employee perspective is really important, because when we talk about customer journeys, we're really talking about employee experience in this case. And you can see here from the Gallup survey that's been done this year, this snapshot was taken during the summer, but a lot of employees are preferring to work remote. So in the column on the right is a total of the hybrid and the exclusive remote columns. And so you can see here that most employees are still heavily leaning to having some ability to work remote. And that disruption that companies have to think about is, what does it mean to get them to come back in the office? You may actually lose a talented employee. You may be producing hardship for an employee, and you may be creating a lot of personal after hours disruption in terms of any adjustments they have to make. And some of those disruptions here, you can see in this slide, that you need to consider is that some of it is because of commute or a sense of well-being, or understanding the flexibility that has been provided as ability to work from home. And those trade-offs or those benefits are a true, issue for employees these days that HR has to consider as part of retaining employees. There is a good portion of folks that want to be on site, but depending on what study you look at in this, we've looked at multiple studies already in this webinar alone. This particular one has a higher amount than I ran across in other research in terms of those that prefer to be on site only. This 41% is, in terms of feeling productive, is probably the highest number I've seen, because a lot of other surveys I've seen, productivity is not as strongly related to being on site. And you can see here, well-being, being productive, they vary across the different strategies, being on-site, hybrid, or remote. Other insights to employee experiences include, these two tables here, where companies, we talked about multiple times, the attrition. The top table is talking about employees that will likely leave as a result of not having the remote option, and you can see here it's pretty high. Up to a third fully working remote are considering leaving. And so you need to understand where your talent base is and look at the impact of your organization as you make decisions on how important it is to be on site. And again, we talked earlier about exploring different personnel roles. Some roles are lend to on-site collaboration. Other roles probably could be web-based collaboration, or remote collaboration is still possible. You really need to understand that before you push the button, because employees are much more likely to leave during this pandemic time than ever before. The amount of remote U.S. employees that are expecting the ability to work remote. You can see here that the number that sticks out is in the middle here, exclusively remote. 40% are expecting, through the end of the year, whereas others are expecting some level of hybrid approach. And so most people will expect remote as a permanent option. And so, in summarizing the employee experience here, if you're going to have them back in the office, you're really going to have to find ways to maintain social distancing. The social distance token that I talked about earlier was a very innovative one that I came across, where it buzzes when it's within six feet of another token. So issuing tokens to all employees is going to be expensive, but that's something that you want to consider if you're really going to shape behaviors. The last thing you want to do is overwhelm your HR helpline with employees calling out others that are not respecting 6 feet distance and whatnot. You're going to want to make sure that your employee experience on site, you definitely have to have your supplies there. So the PPE, personal protection equipment with face masks, gloves, sanitation supplies, wipes, sprays, paper towels, and ensuring that your expectations are met, so that any collaboration spaces are clean, if not by these cleaning staff, then by employees. Definitely high traffic areas need to be wiped down and whatnot. So you want to make sure that you explore providing ongoing remote work and support. Helping employees that have to supply their own equipment at home, providing some reimbursement relief. Internet assistance. Different companies have different capabilities in terms of affording those types of benefits, but you really want to tie it back to job requirements in terms of what you provide benefits for and relief for, and what kind of requirements you want to enforce in terms of being on site. And again, in summarizing this section, it's really about the voice of the customer, and your employees need to come first. And so if you're asking them to really compromise or their health, or put themselves at risk, you really have to provide a compelling case. And so as Beth mentioned, you don't want to come across like you're getting them to come back to work just to come back to work. What does it mean? What's the value proposition? Why are we doing it? It's a question that people are asking. And so the pandemic, because the life and death scenario that has emerged for several folks, people are really exploring, what does it mean? What's the value here for me? What's the fit to my life goals? And what's the satisfaction of getting out of this job? And so this great resignation, I read a story on a young lady that just really went through these questions and decided that she wanted to quit. Didn't have another job ready, didn't have an interview set up, decided to quit. Took a couple months, moved in with her boyfriend, moved to Texas. After several months, decided to sign up for a training class with software development, liked it, dove into it, and now is working as a software engineer. And so employees are more likely now than ever to do this. And so if your company is really, caring for on-site requirements, then you really have to consider impacts to employees and what their options and what their thinking and experiences today. It's very, very different than it's ever been, especially with millennials and the younger population, where the attachment to work is different within that generation than prior. So any questions or comments? I know that we're wrapping up on time here. I am not going to go through our digital economy section, but I just want to make sure that people understand that there are slides here that you can definitely explore. And there's going to be some trends and data points that I provide here, but I'm going to quickly go through to the conclusion as we do not have time to review this section. More likely, we may actually end up with a follow-up. So in quick summary here, the pandemic has reshaped and refocused the personal and professional landscape. And so really, if you're working on the RTO strategy for your company, please do consider the impact to the human experience here. And business architecture is a good discipline because with the mapping to the different systems and locations that are impacted, the different personnel roles, processes, it really helps design a structured way to look at this complex issue. And experience design, I probably don't need to tell you that given that this is a pandemic, it's really a matter of health and well-being. And we really need to take a focus on the employee at the center of all this. So with that, I want to thank you for your time with me today. And I will pass it back to Beth to close out our webinar.
Yeah, I will just speak for a little bit while people take a chance to submit questions or through chat or Q&A or raise a hand. For those of us in education, I found the section that you have to keep visitors and employees separate. Like that's not even a doable capability for us if we're going to do live classrooms. So that layers in a whole nother set of complexities. And I will also say, as someone who is sending instructors out to do training into other organizations, a whole new part of our job now is finding out what that employer site has for COVID protocols and getting them communicated and make sure my instructor feels comfortable. And so there's been a whole other layer of jobs and tasks and work added that didn't exist before. And as with most people, I'm sure I didn't get additional staff added to help with all of that. So, and I will also say, to be honest with you, I've lost some instructors during the Great Resignation as well, where we hire project by project, and a lot of them do this work in addition to their full-time job or as part of their retirement job, and they're like, "Yeah, I'm good. I don't want to teach or consult anymore, so I'm hanging it up." So I've really I think I've ticked every one of your challenge boxes there, Bao. You said we would experience. I'm experiencing them. So panelists or attendees, I'm not seeing any questions from you. I did throw, I did throw in to the chat our registration link for our upcoming virtual class. I guess just last call for anything, any comments, questions? And with that, then, Bao, thank you very much for your presentation. My head is swimming with all the considerations, but I do feel you presented us with some tools and mapping that can help, I I guess, bring some order to the complexity. So thank you for presenting for us today.
Absolutely. And if there's any questions, don't hesitate to outreach to either Beth or I. Be more than happy to pull up and have conversations about this further.
And you got to give us a week or two, but we will get this recording posted on our website. So if you have people in your organization that you think should watch it, send them to go watch it. You can cut and paste the link and send it to them. Or if there was so much information today, you can fast forward through and review a section if you need to as well. So, all right. Thanks, everyone. I usually at this time promote our next business expert insights, and we don't have one on the calendar because we're moving into holiday season, end of year season. So keep an eye out for something sometime in January. That's all we've got. All right. Thanks all. Hope to see you the next time. Bye.
Have a great day. Bye-bye.